Right now, millions of older adults are taking medications that could be silently destroying their hearts. And here is the unsettling truth. These are not street drugs or radical therapies. These are everyday prescriptions, sitting on nightstands and in bathroom cabinets worldwide. Drugs that physicians recommend with routine frequency. A rising chorus of heart surgeons and specialists is raising the alarm. In operating theaters, they are witnessing a pattern that defies expectation. Patients' hearts, which should show normal wear for their years, are displaying profound, unexpected damage. Inflammation is soaring. Muscle tissue is failing. Arrhythmias are emerging without cause. And when these doctors trace the timeline, a common thread emerges. Published science is now validating what these clinicians have observed for years. Respected institutions like the Cleveland Clinic, Johns Hopkins, and the European Society of Cardiology are releasing data that confirms a hard reality. Specific medications, used daily by millions of seniors, are inflicting measurable, sometimes irreversible, harm to the cardiovascular system. This is not about freak accidents affecting a handful. This is about substantial risks impacting a significant portion of long-term users. Some of these drugs elevate heart attack risk by more than 40%. Others double or triple the odds of life-threatening irregular rhythms. And most concerning? Countless patients are completely unaware. Yet among all these, one medication is singled out by specialists as the most insidious threat. The evidence is so compelling that some believe it warrants the FDA's strictest warning for older patients. A study of more than 500,000 people linked this drug to devastating cardiac events. And perhaps the most frustrating part, safer options are often available. But before we identify that primary culprit, let us walk through the full list so you can see the complete landscape of potential risks to your heart. First, tell us in the comments, how old are you, and where are you watching from? We read and reply to every single one. Now, let us begin. Proton pump inhibitors. You likely know them as Nexium, Prevacid, or Prilosec. These acid-reducing drugs are prescribed relentlessly for heartburn and reflux. Short-term, they can be a relief. The danger emerges over years, which is precisely how many seniors use them. A pivotal study tracking nearly 3 million patients found PPI users faced a 16 to 21% higher heart attack risk. The mechanism is both clever and chilling. PPIs seem to deplete nitric oxide, a molecule vital for keeping blood vessels flexible and clear. When nitric oxide drops, arteries stiffen, pressure climbs, and clots form more easily. Stanford researchers discovered that in patients with existing heart disease, PPIs were tied to a doubled risk of cardiovascular death. The silver lining? For many, lifestyle shifts like weight loss, smaller meals, and elevating the bed can dramatically improve symptoms. Safer medications like H2 blockers such as famotidine are also available. But this is just the start. The risks grow more severe from here. Certain antibiotics. This one stuns most people. Antibiotics are lifesavers, but some classes carry a hidden cardiac tax for older adults. Fluoroquinolones, like ciprofloxacin and levofloxacin, are the main concern. Research found current use was associated with a 66% higher risk of aortic aneurysm or dissection, a often fatal tearing of the body main artery. The danger can linger for up to 60 days after the last pill. These drugs also disrupt the heart electrical activity, potentially triggering a dangerous rhythm called torsades de pointes. The FDA now advises reserving these antibiotics for when no safer alternative exists. For common infections, older drugs like amoxicillin or nitrofurantoin are usually equally effective and far gentler on the heart. Nonsteroidal anti-inflammatory drugs. They are ubiquitous: ibuprofen, naproxen, celecoxib. For occasional use in the young, risks are low. But for seniors managing chronic pain like arthritis, the cost can be catastrophic. A major meta-analysis of 350,000 patients found high-dose NSAID use raised the risk of major cardiac events by about one-third. Celecoxib increased heart attack risk by 37%, ibuprofen by 44%. These drugs block protective prostaglandins, tipping the body toward inflammation, clotting, and fluid retention, which strains the heart. Even short courses are not safe. A large Danish study found cardiovascular risk rose within the first week. Alternatives like acetaminophen with liver monitoring, topical NSAIDs, or physical therapy can offer relief without the same cardiac burden. Certain diabetes medications. Diabetes itself threatens the heart, so the choice of medication is critical. Older sulfonylureas, like glyburide and glypyride, force the pancreas to pump out more insulin. Studies link them to a 20% higher risk of cardiovascular death compared to drugs like metformin. They can trigger low blood sugar and may affect heart cell channels, increasing vulnerability. Starkly, newer classes like SGLT2 inhibitors and GLP-1 agonists have shown they can actually protect the heart. This is not just about lowering blood sugar, it is about choosing a therapy that defends the cardiovascular system. Certain sleep medications. Z-drugs like zolpidem and isoprolol are common fixes for insomnia. But research associated these hypnotics with a 4.5 times greater mortality risk, with heart events being a leading cause. They can worsen sleep apnea, a major cardiac risk factor, and increase fall risk, which can precipitate a heart incident in fragile patients. Benzodiazepines like lorazepam carry similar concerns. A more sustainable path includes cognitive behavioral therapy for insomnia, sleep hygiene, and possibly low-dose melatonin, which appears to have a safer profile. Certain antipsychotic medications. Prescribed off-label for agitation in dementia or for psychiatric conditions, these drugs carry a grave warning. A major study of 44,000 elderly patients found antipsychotic use doubled the risk of death, primarily from sudden cardiac causes. They can prolong the QT interval, cause metabolic disturbances, and trigger dangerous drops in blood pressure upon standing. The FDA has placed a black box warning on their use in elderly dementia patients due to this mortality risk. Non-drug approaches like addressing underlying pain or infection and modifying the environment should always be tried first. Prescription opioid pain medications. This is the drug cardiac specialists label the silent heart killer. Opioids like oxycodone, hydrocodone, and tramadol are potent pain relievers, but their impact on an older heart is profound. A large study of over 575,000 seniors found long-term opioid use was linked to a 65% increased risk of cardiovascular death. They depress breathing, lowering blood oxygen, which starves and stresses the heart. They disrupt the autonomic nervous system, reduce heart rate variability, which is a sign of cardiac resilience, and may accelerate plaque buildup. Combined with other common medications like benzodiazepines or blood pressure drugs, the risks multiply catastrophically. The solution is not to abruptly stop needed medication but to engage in informed dialogue. Modern pain management emphasizes multimodal strategies, physical therapy, nerve blocks, cognitive techniques, and careful, supervised tapering where possible. The surgeons sounding this alarm urge awareness and conversation. Medicine evolves. What was once standard may now carry understood risks. Safer pathways often exist. Protecting your heart requires proactive partnership with your healthcare provider. Now, we are curious, after reading this, will you discuss these concerns with your doctor? What hesitations or motivations do you have about starting that conversation? Share your thoughts and experiences below. We truly read them all. Thank you for your time and attention.